Okay, so this is the aftercare video for Juvida for days 3 to day 7. So hopefully you listened to the previous video where we talked about pain and using the saline spray and such things which were targeted for days 1 to 3. So now you can not worry so much about pain, hopefully, and that the pain's all subsided, I'm hoping, by now, and you don't need to worry too much about the saline spray, but you can still use it if you're getting a bit of itchiness. So the main things we're going to talk about now are swelling, okay? The reason we talk about swelling now is because it normally sort of really kicks in at sort of days 3 to day 5 really. So if you are getting a bit of swelling, very much part of the consequences of having the procedure. So don't be too alarmed. And it is normally quite noticeable, and you'll see it mainly across the forehead. So there's several things we can do. So again, don't be worried. What can we do? Well, there's you can use ice. How do we use ice? Normally suggest you put some ice in a tea towel or a bag of peas in a tea towel. So don't put ice directly onto the skin. So wrap it up in a tea towel and then just apply it to the forehead. Okay, so important not to apply it to the grafts. Just across the forehead, and would normally suggest you do that for maybe 15 to 20 minutes at a time, and you can repeat that several times a day, 3 to 4 times a day. And this ice can be pretty good for swelling. The other thing that we would suggest is sleeping positions. So a couple of pillows, you can use the neck cushion as well, and that will sort of keep you about 30 degrees, give or take, and that can sort of help push the swelling downwards as well. And then the other thing is that we send you home with some steroids. So where are we? So steroids used for 7 days. We would have talked about the regime, but just to clarify, so it's 7 tablets on the first day, then 6 on the second day, then 5, then 4, then 3, then 2, then 1. So reducing by 1 tablet per day for a 1-week course. Best to have it on a morning, best to have it after breakfast, so you got a bit of food on your stomach. So the combination of the sleeping position, the ice, and the prednisolone, the steroids, all those 3 things are there to reduce the amount of swelling. But as I say, so it will come down, but all those three things will help. And the swelling is most noticeable sort of days 3 to day 5. The next thing is bathing, so shampooing and things like that. So normally we suggest first 3 days, just don't bother worrying about the grafts, don't clean them or shampoo them. So first 3 days, do nothing. On day 4, you can start using shampoo. So we send you away with a special shampoo, so don't use any shampoo. We want you to use what we send you home with, which I'll just grab in this bag. So it's this here, so use your shampoo from day 4, okay? So how to do it, so just apply a little bit onto the fingertips or the palm, and then just dab it over the grafts, so just to the area of the grafts, and best, you can't use a shower so early on, okay? So get a cup of water and you just pour over the grafts, and that will get rid of a lot of the shampoo, okay? So no shower heads, no, because the power from the shower can sometimes dislodge the grafts. So a cup of water should be ample. And we're going to be doing that from day 4 up to day 10, and then after day 10 you can just use normal shampoo. Okay, so that's shampooing. Linked in with shampooing, we're going to talk about crusts. So crusts will normally form in and around the grafts. It's very normal part of the healing process. So you normally start seeing crusts forming from normally days 1 or day 2, but then actually you'll see more as the week progresses, and normally they should stop at around day 10 or so. So between days 3 and 7 is when you'll see most crusts. So what we normally suggest is probably from about day 6, day 7, you can start trying to remove these crusts. The way you do that, when you're shampooing, just apply a little bit more. Instead of dabbing it, you might just need to apply a little bit more pressure and maybe do some circular motions and some rubbing, and that should be enough to sort of remove those crusts from there. Past day 10, we wouldn't normally expect it. Sometimes it can go up to sort of 3 weeks or so, but most crusting will be in that first week, towards the back end of that first week, okay? So just to recap, swelling we've talked about and how to reduce it through the steroids, through the ice, through positioning of sleep. Shampooing we've talked about, so try not to shower with a shower head in the first week. Better to bathe, and particularly no need to shampoo in the first 3 days. So shampoo from day 4, but very, very gently. Just be careful of those grafts, and then as the crusts form, you can start trying to remove them from around day 6 or day 7. Okay, so hopefully that all makes sense. We shall send you another video on day 7, and that's talking about aftercare from day 7 all the way through to your first follow-up appointment at 3 months. Okay, so we hope to catch up with you then.